Hello, welcome to Hazard Preparation and Resilience. Healthcare is where our most vulnerable population go for help. And working in healthcare means you will deal with situations that you could have never imagined. It is important that we learn not only how to care for people during emergency situations, but also how to care for ourselves in a way that keeps us resilient in this emotionally difficult profession. The term all hazards preparation refers to the many different situations that require the emergency response of outside assistance, which may be at the local, county, state, or federal levels. Natural disasters are unfortunately the most commonly occurring types of disasters that can affect large populations. Earthquakes, tsunamis, tropical storms, hurricanes, floods, tornadoes, these are all examples of natural disasters. However, the type of natural disaster is often unique to the area where it occurs, and the severity can vary. For example, throughout the Rocky Mountain region of the United States, avalanches are a concern. From snow avalanches during the winter season and rock slides during the spring and summer seasons. This clearly would not be a concern for Illinois. However, a flood or tornado should be considered. Cold and heat disasters are also a concern for our area. Winter storms are often not thought of as a natural disaster, but the storms can bring life-threatening cold temperatures, low visibility, and dangerous driving conditions. Transportation can be brought to a standstill. Emergency vehicles, such as ambulances, can experience delays in reaching victims, as well as transporting to an emergency department. People stuck in cars on barren highways or mountain passes are also exposed to hypothermia and frostbite. Carbon dioxide poisoning can occur if they leave the vehicle running for heat, especially if the tailpipe becomes plugged with snow. Opposite of winter storms are heat waves. A heat wave is defined as an extended period of abnormally hot weather that may be accompanied by high humidity. Heat waves are dangerous because the heat taxes the human body beyond its normal abilities. Infants, adolescents, and elderly, obese, or chronically ill people have the highest percentage of being victims of heat wave. Additionally, males are at higher risk for heat-related illness due to sweating more than females. Obviously, the number one heat-related complication is dehydration. However, other serious heat-related illnesses can include severe sunburn, heat cramps, heat exhaustion, and heat stroke. Man-made disasters refer to transportation accidents and acts of terrorism or industrial incidents. The man-made disasters that will be discussed are chemical or radiation release, explosion, infrastructure accidents, transportation accidents, and terrorism. Chemical or radiation release can occur through an explosion, such as bombs or other weapons of mass destruction. Various types of factory explosions would also be included in this, gas tank explosions and explosions inside mines. Explosions have the potential to injure all body parts, challenging healthcare providers in determining the injuries that require immediate treatment to preserve the life of the patient. There will be injuries that are common to many explosions, such as penetrating wounds, soft tissue injuries, fractures, burns, but there will also be injuries unique to the disaster. Infrastructure incidents include the collapse of roads, bridges, or structures. The incidents can be caused by a natural disaster, such as an earthquake, flood, tornado, or might be due to poor maintenance or poor construction. Infrastructure incidents primarily cause crushing injuries and severe lacerations. Transportation accidents are infrequent, but tend to remain in the minds of people due to their large scope of injuries and fatalities. Healthcare providers during an event, a transportation accident, will be treating severe lacerations, fractures, crushing injuries, burns, and eye injuries. Bioterrorism is the intentional use of infectious agents or germs to cause illness. Healthcare facilities may be the initial site for recognition and response to bioterrorism events. All healthcare providers should become familiar with their healthcare facilities' bioterrorism readiness plan. The first indication of an attack is usually when large numbers of patients present with the same set of signs and symptoms. Healthcare facilities must have an emergency action plan that follows state and federal guidelines. This is required by the Joint Commission. The Joint Commission requires healthcare facilities to practice their EAP at least twice a year. The plan must include a response to small or large community disasters, and it must address the following components. Mitigation is the identification of hazards located in the community, with plans to prevent emergencies as well as reduce the dangers. Preparedness, this includes the development of an EAP or Emergency Action Plan. Response is the preparation before the emergency event and actions during and after the event. Recovery are the activities performed to aid the community to return back to normal, such as rebuilding structures, homes, or rebuilding infrastructure. The Hospital Incident Command System is a chain of command that specifies the roles. It allows the healthcare facility to work efficiently with other health facilities and responding agencies. Healthcare practitioner responsibilities include personal responsibilities in responding to an emergency, the departmental role in the healthcare facility, knowing the chain of command, knowledge of the healthcare facility's signals and codes to indicate there is an emergency, and the type of emergency the signals and codes indicate. Procedure for how supervisors will communicate that the EAP is activated, and communication procedures between healthcare facility departments. Government agencies have been designed to handle emergency situations. Local Emergency Management Agency, or LEMA, is an agency that has the responsibility for managing and coordinating local agencies. This would be like your town fire department, EMS, police, during an emergency. The Federal Emergency Management Agency, or FEMA, is the lead federal agency during a nationally declared emergency. It coordinates providing treatment to victims and food and shelter at the scene. These agencies may be notified based on the severity of an immediate response to an all-hazard event. First and foremost, healthcare responders should not enter a scene of a disaster without first ensuring it is safe. It may be necessary to first allow electricians or firefighters or public safety individuals to enter the scene to remove hazards. Healthcare responders will need to create a safe zone as soon as possible for setting up triage and initial treatment area. Standard precautions and personal protective equipment should be worn. There should be a patient decontamination area. This would be for decontamination of patients during a radiologic or chemical disaster. The triage of victims is the process of sorting victims according to their injuries and physiological status in order to maximize the medical resources that are available. The individual performing the triage of patients should be aware of moral, ethical, and legal issues associated with providing care during a disaster. This person must remember that the goal is to treat as many people as possible. Now that we know how healthcare handles emergency situations, let's talk about how we as individuals can handle the trauma of emergencies and remain resilient to continue to help others in healthcare. Physical health. First, it is important we care for ourselves. Earlier in this course, we discussed the importance of Maslow's hierarchy of needs when caring for different populations. Now, I'd like you to think about the hierarchy of needs for your own well-being. Before we can care for others, we must make sure our most basic physiological needs are met. Proper nutrition, exercise, and sleep are essential for your body and for your mind in order to help others. Do not make yourself so busy that you do not have time to care for yourself. Always schedule the appropriate time to plan, shop, and prepare for good, healthy foods. Include time every day for some form of exercise. A simple walk will do the trick. Also, schedule enough time to sleep. Your body and mind need to rest to recharge your system for another day. All of these physiological needs are step one in living a happy, resilient life. Once you have cared for your physical self, it is important to know the emotional tools that will help you with your mental health. The Resilience Project is a program designed by Hugh Van Cyklenburg that is intended to provide people with positive mental health strategies that encourage resilience. As we are all aware, life can be extremely difficult. From our personal to professional lives, we can be sure that we will always have to deal with pain, uncertainty, and hard work. These difficulties require mental health tools that will help us remain resilient and continue the work of helping others. There are 3 recommended key strategies that can be remembered with the acronym GEM. G is for gratitude, E is for empathy, and M for mindfulness. Gratitude is being thankful. Thankful for the things that we have rather than the things we do not have. This helps you to remain a more optimistic or positive person that improves your overall well-being. To practice gratitude, leave a journal on your nightstand next to your bed. Before you go to sleep, write down 3 things that you're grateful for. Only 3. It can be anything, but try to come up with 3 different things each night. Empathy. Empathy is feeling what someone else is feeling. Think of someone you came across throughout the day, maybe someone that you had a disagreement with. Now think of what that person may be going through in their own life. Have they recently lost a loved one to cancer? Did they lose their job or learn that they have a sick child? Imagine what that person could be going through and see if it removes some of the anger you may have felt towards that person. Practicing empathy will make you more likely to act in a kind way in all confrontations. Finally, mindfulness. Mindfulness is the ability to be present, aware, and calm. We discussed mindfulness earlier in the course when talking about choosing your stress response. This requires the ability to stop, think of your reactions, and calmly choose a response. Mindfulness requires us to think about the way we behave and respond rather than instinctually react to all situations. Choosing calm will help you relieve the tension of caring for others and give you the strength to continue to do so. Burnout. Healthcare is currently in a crisis of burnout. A recent survey released by Elsevier Health called Clinician of the Future predicts that up to 75% of healthcare workers will want to leave this profession by 2025. With the rising numbers of burnout, it is essential that our new healthcare workers are trained in resilience. There is no question that this is difficult work, but I ask, what work that is this important is not difficult? To remain resilient in healthcare and continue to help our most vulnerable members of society, always remember these 3 things. Do not forget why you chose this profession. Use this as motivation to continue. Keep your values at the center of your decision-making and use the tools and strategies offered here to remain resilient in this important line of work. If we do not remain resilient, what happens to a society that cannot care for its sick and vulnerable people?